Hello, and welcome to Healthcare Insider, a sponsored content podcast series from Modern Healthcare Custom Media. I'm your host, Maria Castellucci, Deputy Editor of Custom Content at Modern Healthcare. And today, we are thrilled to welcome to the podcast Leora Westbrook, President of Workforce Strategy and Optimization at AMN Healthcare. Leora leads the team at AMN overseeing strategy, technology, and analytics solutions, in addition to consulting services. Leora has more than 20 years of healthcare services experience. She has worked for Fortune 50 companies, led her own client consulting business, and was most recently the Chief Operating Officer of healthcare startup Offer Health. In today's episode, Leora will discuss current challenges in the healthcare workforce and ways to overcome them through technology integrations and strategic partnerships. Leora, thanks so much for being here today.
Thanks, Maria. It's wonderful to be here. Thank you.
So let's dive in. What are the current challenges that healthcare organizations face in optimizing their workforce?
I'd say there's a recalibration happening in the workforce today. Organizations continue to have labor as a top concern. And healthcare organizations are applying significant focus on new and innovative ways to manage those rising labor costs. It's not a surprise that the accumulation of various facets, COVID-19 included, have resulted in burnout and resulting turnover through the years. This has led to a more chronic staffing shortage across various roles. So now is really the time where healthcare organizations need comprehensive workforce management strategies.
Yeah, saying that it's a chronic problem, I think really encapsulates what health systems and hospitals are going through right now with their workforce. So, what are the key tenets of a successful, effective workforce management strategy? What components are involved?
Great question. First and foremost, it's harnessing the enterprise capabilities of a healthcare organization. And that starts with a data-driven approach to develop those dynamic staffing models that really provide the right mix of both core and contingency or flexible resources. And this allows for more cost-effective workforce management that is based on a number of changing conditions, such as patient volume and ensuring quality by optimizing staff levels, also empowers individuals. It gives them opportunity and exposure to new and different areas across the health system, building on their competencies, and also ensuring that they're working at the top of their training and licensure. Now, every organization is different. There is no one size fits all approach, but every organization fundamentally, Maria, is going to need certain layers of staff to ensure they can meet patient demand. So some organizations, as an example, with less variability of patient census and staff behaviors such as PTO, absences, etc., they might be able to have more core staff with less need for layers of that contingency or flex staffing sources that I mentioned previously, while other organizations that experience greater swings in census and have higher frequency of staff behaviors are likely going to need to lean more into that contingency layering level to adjust to fluctuating demand. And so planning and right sizing that staffing sources are key. And this is only made possible through accurate predictions of that need, leveraging analytics to provide prescriptive guidance to our clients.
Okay, so that's a great segue into the next, question. So how can data analysis and predictive modeling help organizations better understand workforce dynamics and make informed decisions?
Absolutely. The foundation of our approach to healthcare enterprise labor management, which we refer to as our HELM methodology, is that ability to produce the accurate predictions of need, leveraging analytics that will provide that prescriptive guidance to our clients. So we leverage our clients' data along with our guidance, backed by 25 plus years of expertise in this space, to deliver intelligence that uncovers the opportunities most critical to optimizing their workforce. In fact, our workforce analytics provide a consolidated view of both core and contingency, again, at that enterprise level, with the ability to drill down to the unit and even staff member. And it, in essence, gives the capability to conduct that trending analysis. So allowing team members to understand and explore patterns, determine root causes, and glean actionable insights. The dashboards are truly powerful. And the schedule dashboard, as an example, allows our managers to evaluate staffing outcomes and trends that help to pinpoint opportunities for additional focus, such as overtime. While the financial dashboard provides daily productivity outcomes and compares actual hours to those budgeted hours to see really what is the variability of your cost to your fixed hours. And finally, the variance dashboard blends the schedule and financial dashboards that provide really the insight into variances behind what is scheduled versus those actual hours worked. And this is really powerful, Maria, because it helps the managers identify the trends, such as staff members clocking in earlier or staying later than their scheduled time, so that they can make meaningful interventions where it's appropriate. I'd also mention, in addition to the analytics, the workforce strategy and optimization evidence-based solutions also includes a powerful platform that is referred to as Smart Square. This is our healthcare scheduling software. And Smart Square is the only healthcare scheduling software that combines the demand forecasting with that robust scheduling functionality, enterprise transparency, and business intelligence tools all in one application. It's a SaaS-based platform, so it provides for fast implementations, and there's no versions that your teams have to manage and ensure they have access to. So it's always available, that latest version, at no additional cost. Updated weekly or even more frequently, these predictions pass through staffing matrices for each unit and service area, and that clearly identifies the predicted demand versus supply. So taking a step back to go forward, I'm going to geek out a little bit because I love this stuff. And it's really the recipe to success, the secret to our sauce. Our technology can forecast patient demand that allows for the proactive alignment of staffing resources up to 120 days before the shift. 120 days. That is so powerful for our client partners. And the results have showed that the predictions made 60 days out were within one staff member that was needed 96% of the time. 96. And that only improves as you get closer to the shift. At 30 days out, our Smart Square OpenShift technology comes into play. This is a really cool patented sliding incentive scale that offers the highest incentives 30 days before the shift and automatically decreases as staff pick up shifts. So as a result, what a lot of health systems are used to, we'll call that crisis pay, to fill those emergent, pressing roles or shifts, if you will. We have 75% of the open shifts filled more than 2 weeks before the shift, with the incentive ranges set by each organization. That allows those open shifts to be filled sooner and in line with budget. So in totality, the Smart Square Enterprise solution is an amazing, amazing solution for our enterprise healthcare organizations, not just in the acute hospital setting, but it's also being deployed in clinics, ancillary, long-term care, and senior care settings. And our consultative advisors provide that partnership to truly develop and automate that strategic labor plan.
Yeah, Leora, that was really interesting. That sounds like a really fascinating technology. So, can you dive a little deeper? How does AMN Healthcare partner with organizations to transform their workforce optimization strategy?
Well, I will tell you that it does not happen overnight and that it is an absolute transformation, as you said, that is driven through effective change management processes that are at the core of what we do. So we do not simply provide our clients with the analytics or even the scheduling solution, SmartSquare, and walk away. We really partner to help establish operational efficiencies that are going to provide the framework for predictable and, as important, sustainable improvements that pave the way for implementing and advancing workforce management strategies. Our workforce optimization includes a comprehensive diagnostics, workforce and operational assessments, so we can really understand how they are staffing to their policies, their practices, their structures, their governances. We assess staffing models and holistic planning solutions, such as our workforce planning dashboard, our talent strategy scorecard, as well as flexible staffing strategies and integrated data-driven talent advisory solutions are what is really moving the needle forward for our client partners. I couldn't say it enough that a partnership is key to advancing workforce capabilities. And we are 110% committed to collaboration, communication, and providing that quality service, high reliability, the practical guidance, insightful analysis, and innovative capabilities. As I mentioned previously, Maria, there's no one size fits all, and it is a journey that we truly lock arms with our partner so they can find that optimal nurse scheduling that works for them, the dynamic staffing models that we talked about. And we are with them every step of the way, problem solving to tailor to their organization's unique and evolving needs.
Yeah, that's great, Leora. You've painted a really great picture of how this technology can be really transformative. Can you provide examples of successful workforce optimization initiatives and the impact they've had on the organizations?
Absolutely. The trouble is, Maria, it's hard to pick just one or two, but I'll try. And my mind goes first and foremost to our clients that are leveraging the insights from the comprehensive workforce assessments and the workforce planning dashboards that I mentioned previously to create that robust workforce management team. So one of our clients focused on enterprise staffing, scheduling, and building out a central staffing center, what we also refer to as a resource management center, that really ensured the right person is at the right place, time, and cost. And so this resource management center was an impactful solution to not only control costs, but coordinate care and ensure the consistent practices across a health system, as well as providing that predictability as well as flexibility that our clinicians are looking for today. So we provide that outsourced resource management center services. We can also do it in hybrid approaches. And we also really consult and educate to help the health systems establish what is that right model for them. The dashboard, our workforce analytics, allows our client partners to reallocate and layer their resources based on demand. And the client that I've been speaking of was able to decrease their turnover by 17.4% during what I would call some of the most challenging times in the pandemic and increase their float pool by 35 FTEs. Another health system, and this is an academic health system, we partnered with successfully leveraged the power of our technology solutions to build a more balanced workforce landscape. This resulted in over $12 million in cost savings. And since 2021, our partner has built out that data guidance and utilization foundation to allocate and balance their workforce. So there's a lot to unpack as far as how this was driven, but I'll share some of the highlights. Included a 92% fill rate and a 4.1% turnover reduction. The relationship success was made possible only through the commitment, trust, buy-in, and transparency, as well as action of our client partners from day one. The results are a true testament to the power of that partnership.
Yeah, those are very impressive results given all of the challenges healthcare organizations are facing right now. To experience that level of cost savings and that low percentage of turnover is fantastic. Well, Leora, thank you so much for being here today. We are at the end of our time together.
Thank you. It's been an absolute pleasure, Maria.
This has been a sponsored episode of Healthcare Insider created in collaboration with AMN Healthcare Services. If you'd like to connect with them, please email client.services@amnhealthcare.com. I'm your host, Maria Castellucci. Look for more episodes of Healthcare Insider under the Multimedia tab at modernhealthcare.com or subscribe to your preferred podcatcher. Thanks for listening.